One of the points that is very prevalent in society now is physical appearance. And many of these children have problems because their physical appearance is different than what we see in the great majority of people. The work that the team does, and Dr. Gilardino really champions, is a dramatic change in the physical appearance of these children. That by itself is something that changes lives completely, and quite sure often enough brings security to the kids and a better opportunity about enjoying life.
There's only a very few craniomaxillofacial surgeons in this country that have that special expertise. And this is what we have gained in the children by having Dr. Gilardino return to our hospital.
Hi, my name is Mirko Gilardino. I'm a pediatric plastic surgeon here at the Montreal Children's Hospital, and I have the great privilege of running the craniofacial and cleft surgery program here.
When he was 12 years old, his uncle took him to a first aid program. He loved the idea of being able to help people and even to save lives, actually. So he was totally and completely enthralled with the program.
I think after I saw my first operation on TV, I was enthralled by the specialty and continued on through my studies, learning more and more about it. So it's been definitely a long-seated career goal.
There was nothing else that he talked about afterwards in terms of career. It was always medicine, medicine. He wanted to be a doctor.
He was self-motivated from a very young age to continue. We discussed it many times when he wanted to continue into the cranial reconstruction. I thought it was a great thing, and I gave him all the encouragement I could have, but he was focused.
Well, I think that Mirko, since he's been here, has done a great deal to develop and advance the craniofacial program at the Children's. We didn't have much of a program actually before we came. We certainly had the ability to do the surgeries and the procedures, but since he's come, he's unified the various practitioners into sort of a functional group, and we've had a more consistent approach to dealing with the patients. I think he's brought the very latest techniques and innovations, and I think we've provided a better service to the craniofacial population since he's been here and directing that program.
The group is actually an idea that's not brand new. I certainly didn't create it, but what it is that these kids have major issues that are complex and involve frequently the expertise of a neurosurgeon, an ear, nose, and throat surgeon, speech pathologists, orthodontists and dentists, oral surgeons, a whole group. I'm certainly not naming them all. What we do is we take a child and I first meet them, and then I ask their permission to discuss their case at a round table with all the specialists there. And in doing so, in one fell swoop, I can create a plan, a treatment plan for this patient over a period of years that helps to minimize the number of surgeries they have by combining different surgeries and looking to see what is the best treatment right now versus down the road versus down 10 years down the line. So it allows us to get a lot of bright people in a room thinking about how to best care for a patient, and the overall goal is, of course, to give these kids the best possible outcomes.
En chirurgie pédiatrique, le multidisciplinaire est très très important. On ne fonctionne pas en silo, on fonctionne autour du patient. Et puis ce rôle-là qu'il joue à la clinique cranio-faciale, coordonner les services, planifier les chirurgies, en plus de ses qualités de chirurgie, font de lui un excellent ambassadeur pour notre département.
Mirko has a heart of gold. He's very kind to his patient, extremely respectful and disciplined, and he will go out of his way to care for his patient. And this is very important for me also as a human value, and I want to have the best team of doctor and surgeon who will be caring for their patient while achieving a high level of academic excellence.
He's done incredible work. We see the before, we see the after, and it's amazing the result that we're getting. I wish we had had him about 30 years ago, and those kids would have benefited from the technology that we have today. Technology and talent from his part.
He takes a lot of time going over each case meticulously with all of the staff, right from beginning to end, from the time that patient is seen in the clinic until the surgery is actually performed. And I think he interacts very well with children of all ages, young children as well as teens.
He can see 3 steps ahead, which is always beneficial for anyone who's in the position that he's in.
The deformities that Dr. Gilardino is correcting are severe deformities. And as the child gets older and reaches school age, even kindergarten, they are often severely teased because of their appearance.
Ces jeunes-là, ils ont vraiment des vies pas faciles à cause de la déformation au niveau de leur figure, de leur crâne. Fait que oui, ils sauvent un petit peu des vies étant donné qu'ils leur donnent une vie normalement côté social. Ces enfants-là sont capables de se faire plus accepter par les autres enfants et de mieux s'intégrer au niveau de leur vie de tous les jours, là.
So they do better at school, they do better with their interpersonal relationships, and hopefully they do much better in the academic side of their schooling.
Often enough, a number of these surgical procedures are done by a variety of medical reasons. If we don't expand the cranial cavity, the brain can be compressed, and that can affect cerebral function. You know, the face being so important in many of the human functions like talking, chewing, is affected often by these syndromes. And correcting this aspect of the deformity is going to improve not only the physical appearance, but it's going to definitively preserve cerebral function and improve global functioning.
After about 6 hours, she is in intensive care, fitted with this device, an external halo distractor. Her parents had to turn the screws every day. That would pull her face gradually forward. It's a hard time for Cynthia, but 1 month later, there's a noticeable difference in her features. You look so pretty, her mother says.
I mean, now she will be able to see it in the mirror and see the difference.
How you doing? Very good. She's free now. Yeah. Okay.
And so happy to see her, finally see her face.
Je remercie Dr. Gilardino parce que je trouve que c'est un bon docteur, il fait un beau travail. Puis j'ai confiance en lui parce que il a fait beaucoup de changements pour moi, puis il a amélioré beaucoup de choses dans ma vie.
Merci de m'avoir aidé parce qu'avant je ressemblais pas à ça, puis mes amis et ma famille trouvent que l'opération s'est bien passée. T'es très gentil.
Le docteur Gilardino qui aide beaucoup de gens, transforme des vies, mais non seulement au côté médical, physique, il y a un côté humain assez développé, il nous met très à l'aise et nous met en confiance très rapidement. Ses services sont extraordinaires, je voudrais sincèrement le remercier. Merci.
Alors Mirko, félicitations pour cette reconnaissance. Je crois que tu la mérites vraiment pour tout le bon travail que tu fais pour tous les enfants.
C'est un travail qui est récompensé parce que les efforts sont là et c'est un investissement, je pense, que la communauté fait en l'avenir du crânio-facial et je pense que grâce aux efforts des derniers 3 ans, on note vraiment déjà des changements importants dans la façon de traiter ces patients et félicitations.
It's a pleasure for me to congratulate you, Mirko, for me and Dr. Gilardino officially for this achievement of yours and your great work. Alors, félicitations à Dr. Gilardino pour son très bon travail.
Congratulations, Mirko. You truly deserve to be recognized today, and you make such a huge difference in the world. I'm very proud to be part of your life.
I'm sure you'll do great things. We wish you all the best.
You deserve everything that comes your way, and I think that this award that you receive is just recognition for the person that you have become.
I know in my heart that he would be a very, very good doctor, because he was conscientious about everything. He was such a good person. And I do congratulate you, Mirko.
Mirko, I just want to give you the most heartfelt congratulations on the award that you're receiving, at the recognition that you're receiving tonight, and through the foundation. I think that the work that you do is just astounding. I'm exceedingly proud of you, and you are so deserving of this award. You have such a sense of responsibility and dedication and love for your patients and care for their families. You really do deserve this. With love from your mother.
I think you are a superb leader for the craniofacial team and a great team player. Congratulations, and hope to be working with you for many years to come.